Thanks very much, Zoe. Now, Sunday marked World Tuberculosis Day, which is commemorated every year on the 24th of March since 1882. Now, this is the day when German microbiologist and physician Dr. Robert Koch announced the discovery of the bacterium that causes the disease. And each year, 1.5 million people die, and more than 9 million people are infected with TB. And here to help us unpack the symptoms and to understand exactly who is at risk are doctors Thato Mosidi and Dr. Bart, Willems here with us. Thank you very much for joining us this morning.
Thank you. Good morning.
All right. So let's start at the very beginning by first starting to understand the symptoms of TB.
So I think a lot of people would know that the most commonest symptom that you have for tuberculosis is a cough. You have that very persistent cough that's ongoing and doesn't go away. And the other features that you should look out for is weight loss, night sweats, particularly when you wake up at night and you're drenching wet.
Yeah.
Okay. Then you could also have a cough that's mixed with a little bit of blood, loss of appetite, and I think those are the commonest symptoms for TB that one can experience.
And as it stands right now, Dr. Willems, who's most at risk of contracting TB?
TB is very common in South Africa, as you explained, and TB is transmitted through the air. So South Africa, with a high TB burden country, anyone is at risk because we all breathe the same air. Then, of course, there are people who are more at risk. We know that because smokers put their lungs through a bit of stress, smokers are more likely to contract TB. People with immune-compromised diseases. And then one very important category is healthcare workers. Healthcare workers are at risk because they are, in their daily lives, while working and treating patients who have TB, get in close contact with TB, so they're at more risk. So the World Health Organization recently made it very clear that healthcare workers is an important risk, and it's very important to keep them safe and healthy, because they are the people who will treat the citizens in the country who has TB.
Absolutely. So from a preventative point of view, is it possible to be vaccinated against the TB virus?
Unfortunately, we don't have an effective vaccine for adults currently. We do have a BCG vaccine, which is given to children, to babies when they're born, but that only protects babies from very severe forms of tuberculosis in their infancy. For the rest of us, for adults, unfortunately, we don't have vaccines, and we're really trying to raise more funds so that these vaccines can be developed.
So you've got to take good care of yourself. So with that being said, and speaking early on, the doctor, you were speaking about the fact that smokers put their lungs under stress, and that obviously puts them at a higher risk. So does that follow then to say that people that have an underlying respiratory illness, something like an asthma or bronchitis, are also at higher risk?
Yes, they're also at higher risk. So just coming back to the vaccine, it's very important. The BCG vaccine is one of the childhood immunizations in South Africa. And it is protective for children to take the BCG vaccine because it prevents them from getting severe TB. The thing is just the effectiveness of the vaccination wanes over time.
So it is important that you actually stick to that schedule that is prescribed. But if you do miss the date, you can still take the vaccine at a later stage, but as you said, the efficacy of it is then compromised. So just generally, I mean, you did say that TB is an airborne virus. Is that the most common way that it spreads, and how else is it spread?
So generally spread, as Bart mentioned, it's in air droplets. It's in the air that we breathe. So a person who's infected with TB, when they sing or they cough or they speak, they're able to spread out these droplets into the air, and somebody else can breathe in that same air. And that's how you become infected. That's essentially how it gets into your lungs.
And where in practice do you find that it spreads most commonly? What kind of places?
So it's usually very overcrowded areas. And we also notice that people who live in overcrowded areas, because there is no circulation of air in very enclosed areas, we're talking about prisons, we're talking about institutions where people might be living in for long periods of time. This is the kinds of environments where the TB bacteria is able to sit in the air for long hours of time, and people are able to breathe it in.
So, and of course, all other sorts of congregated settings. So we've proven that in the winter, when people all together drive in a taxi and all the windows are closed, that's a possibility. If someone in the taxi has TB and he or she coughs, it could be spread to other people. Places of worship, and even healthcare facilities are a risky area. So the chances of contracting TB is more when there's a congregated setting with many people breathing the same air.
Yeah. Well, certainly learning a lot in this
Yeah.
conversation. Of course, with the 24th of March being World TB Day, we are coming to grips with understanding the disease and exactly how it's spread. We'll have the doctors sit a while longer so that we can question their minds a little bit more later.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show Expresso on SABC3. I'm going to speak a little bit extra loudly. As you can see, my mouth covered by this protective mouth guard, if you will, zero stigma. We're talking about the fact that the 24th of March was World TB Day. And so with that in mind, we've called in Dr. Mosidi and Dr. Willems to help us better understand this disease, how it is spread, especially in our communities and our congregated areas, so that we can manage it more properly in South Africa. We've got some shocking statistics that about 1.5 million people die every year from TB. 9 million are affected or infected every single year. So during the break, I was asking the two of you doctors whether we should go about wearing these kind of protective masks when we walk around in South Africa. Are we at that level of infection, of airborne diseases, that it's actually a practical safety and health measure to wear these?
So I think the correct answer, and we see the people in many of the big cities in the east wearing the masks.
Yeah.
And they're wearing it because the air pollution is really bad in those cities. But in South Africa, in most of our cities, the air is generally fine to
Quite
breathe.
clean.
So we recommend when people go to healthcare facilities, the healthcare provider would probably give them one of these to wear if they have symptoms of TB.
Yeah.
So if they're coughing, because that is protective of other people. So when they cough, the bacteria is caught inside the mask and it doesn't as easily spread to other people. Also, we expect healthcare workers to wear respirators that filters the air that they breathe in to make it less likely for them as a high-risk population to contract the TB.
And that's actually quite a practical thing that you've just mentioned that I never thought of. For instance, if you're going to be going to a clinic to be treated for something completely different, get yourself one of these masks, because you don't know what germs you might be exposed to in that facility, for instance, while in the waiting room or, you know, with all the other patients that are waiting to be helped. So what should I do if I know that I have been exposed to the TB virus?
Yeah, so yeah, the TB bacteria. So very importantly, the most important thing is if you experience the symptoms that Thato mentioned earlier, cough for extended period of time, weight loss, night sweats, maybe a little bit blood in the cough, losing appetite, you have to report to a healthcare facility. And at the healthcare facility, you'll be seen by either a nurse or maybe a doctor. And they will examine you and ask you about your history, and they will then enable you to get tested for TB.
Okay.
And in South Africa, we've got a huge drive to test anyone who has TB symptoms for TB, because the only way to get to treatment and eventual cure is to be tested.
Yeah.
And I think what's quite important is that the treatment is free.
Okay.
It's available
great.
in all South African health facilities. You don't have to pay for it. So it's, you know, it's accessible. You can go down the road from your home into the clinic and get the test.
Yeah.
So coming back to your question, what do you do if you know you're exposed to TB? So in South Africa, many people are exposed, but the ones that we care about most are the ones who lived closely to someone who we know contracted TB.
Yes.
So if you're a family member of someone who contracted TB, or if you work in close proximity to someone you know who contracted TB, we'd recommend that you also visit a healthcare facility, because you can take medicine to prevent you from developing TB disease if you were exposed.
Yes. And once you are tested, am I right in assuming that you'll come up with a result that says you either, let's say you have the TB bacteria, that you either have latent or active TB? What is the difference between those two?
Maybe we should explain the difference. So latent TB happens when you have been infected with the tuberculosis bacteria. So you have the bacteria in the air and you breathe it in, and once that's in your lungs, you are now infected. But you don't yet have the symptoms that I mentioned earlier.
Okay.
Once you start developing the cough and the fever and the night sweats, then you're designated as active TB.
Okay.
And that's important to get the treatment at that stage, because you could be infecting other people as well when you cough. Yeah.
We also want to speak about the stigma around TB.
Yes, as the mask says, zero stigma.
So it's very important for, if you know someone who contracted TB, or you think they might have TB because they've been coughing for a long time, rather than shunning them or pushing them out of the social circle, or being mean to them at work, we would really support you to make sure that this person gets supported to get to a healthcare facility. And when they are on treatment, to support them and be with them to make sure that they complete the treatment, because that's the safest and best option for the patient who has the TB, but also for everyone else.
Yeah.
So instead of, be supportive of people with TB, ask them what they need and make sure that they complete the treatment, because many of the medicines have side effects.
Yeah.
And sometimes people start feeling much better, but then the medicine makes them feel a bit bad.
Yeah.
And then it's very important to make sure that they are supported to complete the course of TB treatment, which can be 6 months long, and sometimes if someone has drug-resistant TB, up to 2 years long. So it's a massive commitment from the patient side to get healthy.
Yeah.
But of course, the patient also does that to make sure that everyone else around them are also protected.
Absolutely. Well, we have a caller on the line, so let's say hello to Michelle. Good morning, Michelle.
Yes, good morning.
So good to have you with us.
Doctor, my son had TB when he was 1 year old. Primary TB of his cell that he got from our gardener, which then had TB. Now, there are other TBs besides TB of the lungs. He was 1 year old, he didn't smoke. You get TB of the uterus and TB of your knee and TB. Is that not the question that should be answered also?
All right, so let's talk about the different types of TBs that Michelle is referring to here, saying that it's not just TB of the lungs, right?
Yeah. So generally, when someone with TB coughs, the bacilli are floating in the air. Someone else can inhale that TB. And normally the first infection happens in the lungs. But then it's possible for the TB to spread to any other part of the body.
Yes.
And then it's often a bit more difficult to diagnose because they can have TB of the meninges, then you get TB meningitis. As the lady said, you can get TB of the uterus, you can get TB of the bone and the spines.
Okay.
So then the investigations and the treatment modalities would be different. So that is, it is possible for TB to develop in other parts of the body. So that the most common part of the body to get disease with TB is still the lungs.
When it comes to things like these, I always want to ask what the test involves, because I think a lot of people might be scared not knowing, am I going to be asked to cough into something? Am I going to be pricked and blood samples taken? How does a TB test work?
So most likely, if you're a person going to a health facility and you ask for a TB test, they do actually ask if you are coughing.
Yes.
They are going to ask to take samples of your cough. So you'll get 2 little containers, and you can either do it at the facility or maybe take it home if you're unable to cough at that time. And they try to see if there's any of the TB bacteria in that cough. So it will be sent away to the lab, and they use obviously very fancy machines to see if the bacteria is in there as well. There are other tests that may need to be done depending on where we suspect the TB is, but most commonly that's the test that you do. Then the other test that you could be asked to be done is a chest X-ray. So as everyone knows, you take a chest X-ray and then we look at your lungs and see if there are any signs that are suggestive that you have tuberculosis infection. Yes.
Well, fantastic. Doctors, thank you very much. That's all the time that we have, unfortunately, but I think the message that's very important here is that we do need to get tested. Unfortunately, these tests are freely provided for at all South African health facilities so that we can, at the end of the day, just protect our communities. So if you are looking to be tested and you're experiencing any of the symptoms that the doctors were referring to, do visit your medical practitioner as soon as possible and get tested. We're going to take a quick break and we'll be right back with more on your Feel Good Breakfast Show.
It's my Feel Good Breakfast Show.
Yes, it is, and we're back again on this Tuesday morning, back by popular demand with Doctors Mosidi and Willems from TB Proof, and we're discussing TB because the 24th of March was International TB Day. All right, let's get back into our discussion, and very interestingly, Dr. Willems, during the break, you were telling me about the latest developments on a governmental level. What is happening at the health department with regards to TB?
Yeah. So we as TB Proof, our organization's name is TB Proof.
Yes.
We have identified that healthcare workers as one of the high-risk groups. And on a national level, our National Minister of Health, Dr. Aaron Motsoaledi, is a fantastic guy. He's really been fighting for TB on an international level and put it on the map. But there's one thing that we really hope he'll finalize shortly, and that's an occupational policy for TB in healthcare workers. So this policy has been in development for a while, And as we said, healthcare workers are a high-risk group, and we're hoping that he'll be able to finalise this policy to show his commitment to protecting healthcare workers from contracting TB.
Yeah, all right, great stuff. And in terms of TB Proof, what do you as an organisation do?
Right. So TB Proof was founded by a group of doctors and other healthcare workers who themselves were infected with TB,
Yes.
just like Bart and I as well. And basically what we do is that we advocate for all issues about tuberculosis. Obviously, occupationally acquired TB is at our heart because we all acquire TB in our workplaces, but we also advocate for the normal, everyday person in terms of better access to drugs, in terms of better health care for patients, and also just giving general support to people who don't know what to do if they have TB.
Yes.
So a lot of times people don't know where to go and they don't know who to ask once they've discovered that they have tuberculosis. And we always advise them to just look TB Proof up, and they can find a community where they can ask all sorts of questions and just find out a little bit more about what TB is and what they should do when they have TB.
Yeah. So once you've been tested, diagnosed, and have taken your treatment as prescribed, are you then referred to as being cured of TB, and that's it?
Okay. So you obviously have to be tested,
Yes.
and you have to get the correct diagnosis because there are different types of TB. And once you have completed, and again, we have to stress that you have to complete your treatment. It's quite long, it's quite arduous, but you have to complete the treatment.
It's very important.
It's very, very important.
The alternative is that if you don't complete it according to prescription, the virus or the bacteria, could
itself
actually
could
modify.
be resistant, and then you get the resistant forms of TB, and that medication is even more difficult to complete because there's so many side effects. So we do stress that patients finish their treatment as much as possible, and for everybody around them just to give them that support.
Yes.
You know, I think we've gone through it ourselves, and it was not easy. I mean, even with our medical backgrounds and knowing that you have to complete this treatment, it was very tough.
What was the most challenging and perhaps, the most challenging part about, walking around knowing that you have TB for yourself personally?
So my biggest worry is that I could spread the TB to other people, friends or family. So that's why I really wanted to make sure that I don't skip one dose of my medication. And I had a very fortunate, I had drug-sensitive TB. So my treatment was 6 months. I took a few tablets. I have an example of what they look like.
Yes.
And eventually I was cured. My function is perfectly normal, which means TB can be cured, and people can live a happy and normal, healthy life after TB. I think Thato's experience was a bit different. She contracted drug-resistant TB. So our means to treat drug-resistant TB is much more blunt. So there hasn't been really excellent development of new TB medicines, and therefore the treatment for drug-resistant TB is a bit more serious and has more side effects than normal TB. So maybe Thato can just talk a little bit more about what was the challenges
very shortly,
for her.
if you could.
Yeah, definitely. So I had extensively drug-resistant TB, and in total, I took treatment for just over 2 years. So it required almost over 30 tablets at some point in time that I was drinking every single day. And I think really for me was the support that surrounded me when I had tuberculosis. I had friends, I had family always encouraging me to take my medication and to complete the treatment, which is not what everybody has. I think the stigma also is a very big issue, and we do urge people that, TB can happen to anyone. TB can really happen to anyone. It doesn't matter whether you're old, young, poor, rich. If you breathe, you can get the tuberculosis. So we really need to be open about what's happening to our communities and give those who need support the support that they need.
Well, thank you so much for sharing your stories with us this morning, doctors, and helping us to unmask the stigma. And there you have it. You can check out TB Proof online if you're seeking more information. Right now, time for the news.